For more, I'm joined by Lanhee Chen, fellow at the Hoover Institution, and Dr. Zeke Emanuel, former Obama White House health policy advisor and MSNBC medical contributor. Doctor, let me start with you. Well, we played the clips there. Dr. Fauci said he is very nervous about the data, the numbers that we're running through right there. I do note in some of these states, there are these reopening steps that are being rolled back in some cases, bars, nightclubs, gyms, in-person drinking, I think in Florida they decided to do away with. Are enough steps being taken, do you think, right now? And if not, what are some of the most important steps you think these states should be taking?
Well, these states are all on the exponential increase in terms of number of cases, and you can see that just by looking at the graphs. This was very predictable in May when they opened up without having a decline, and when they, started having these big gatherings at the Memorial Day and afterwards. And if you're on the exponential increase, you really do have to do an extreme lockdown. And so these half measures are exactly the wrong. I mean, they're good. They're going in the right direction, but they're not sufficient. It's not going to be enough. You have to actually have people at home, close non-essential businesses, stop bars, stop indoor dining, have everyone wearing face masks. These are the things we need to do. And by the way, just doing it in isolated places isn't going to solve it either. You need to do it nationwide. It's not like people in Florida stay in Florida or people in Texas don't travel to, say, Louisiana or Arkansas or neighboring areas. And so if you only do it in Texas, other places are going to begin to see rises also.
Lanhee, let me bring you in on that because I know you have written about trying to balance controlling the virus until there's a vaccine on this with having some reopening, trying to get back to some semblance of life in this country. I'm curious, what do you make of what Dr. Emanuel just said about the steps he thinks ought to be taken right now?
Well, a few things. I think, first of all, the notion of trying to do a little more regional coordination makes sense to me. I'd love to be able to see governors of neighboring states, for example, getting together and figuring out what are some ways we can work together to begin to peel back some of the trend that we've seen in the last few days, which is troubling indeed. The notion of a complete lockdown, I just don't think works at this point. I think given where we are in this reopening process, the biggest question in my mind is what are the targeted interventions necessary? And in some cases that will be rolling back, in some cases that will be closing bars, indoor dining, et cetera. But in other cases, it seems to me that we need to be a little bit more surgical this time around when we think about how to deal with this outbreak. We know a lot more about the virus, Steve, now than we did when we put in place some of the initial lockdowns. We know a lot more about transmission and some of the scenarios which are more troubling and more difficult, those indoor facilities in particular, gyms, some of the other places that got opened up. So I think a targeted approach, figuring out what we need to shut back down, figuring out where we need to taper back down, that makes a whole lot of sense to me, in addition to a regional approach that takes into account some of that mobility between states.
Doctor, what about what Lanhee is saying about the difference between indoor, outdoor, being in a restaurant, being in a bar, being in a nightclub, something like that, versus being out on a beach? I see that these beaches in California, Florida, some of them announcing they're not going to be open for the 4th of July weekend. For folks who've been inside for months now, who don't have jobs, all of this, is there a pragmatic case for, okay, no restaurants, but yes, beaches, yes, parks, yes, get outside, get some air?
Look, Steve, you're exactly right. There are 4 things that dramatically increase your risk of transmission: enclosed spaces, crowds, very prolonged exposure, and deep exhalations, coughing, sneezing, yelling, or singing. It is possible to have a few people on a beach that you can physically distance in the outdoors, and that's fine. Unfortunately, what we have been seeing is that you get these massive crowds over prolonged periods of time, and that does counteract a lot of the advantages of being outdoors. That's why indoor bars are a bad idea, indoor restaurants are a bad idea, gyms where you have forced exhalations and you're indoors for prolonged periods of time are also a bad idea. But if you just open up the beaches and on the 4th of July, hundreds, if not thousands of people crowd small areas, that is going to counteract all the advantage of being outdoors. So I don't see this surgical strike here that we're going to get and that we're going to cure this thing. The thing that's bent the curve in New York and brought it down was a pretty substantial closing and limiting of crowds, not to 50, but to 10.
Well,
and that was needed in Italy and other places. We're not unique. And if we do these half measures, it'll continue.
I just want to follow up on that, because the situation you're describing, crowds packed together on a beach in an outdoor space, being a vector of transmission here. I'm thinking back to the protests we've seen over the last month, and I know there's been some debate over, did this cause, will this cause, is this going to contribute to an increase in the cases? I'm seeing all of the numbers rise in so many places among younger people in particular. What you're describing about the beach sounds like the protests in a lot of ways. Do you think these protests have contributed to this?
Well, that's an empirical question, and we'll have to see. I will note that a lot of the protesters a lot of them wore face masks. That situation was complicated by the use of tear gas, pepper spray that caused the deep exhalations, forcing people into small areas, things that the police did to aggravate potential spread. But Steve, that's an empirical question. It's not a thought question, and I don't think we have definitive data on whether the rate increased or not. But we have good reason on beaches people aren't wearing masks. They are crowded together, and they are there for a prolonged period of time. That is not a good combination. And then they also crowd, by the way, at food areas, at bathrooms and other places for, while they're getting refreshments or going to the restroom.
Lanhee, let me just get a last thought from you. What are your thoughts on that?
Well, look, I think it's fairly clear that anytime you have a significant gathering of people, and that includes people who gathered to protest, you are raising the probability of transmission of the coronavirus. Some of those protesters wore masks, some did not. So surely it is the case in some urban areas that we are seeing rising numbers, and it's a function of all of these things. I don't think it's right for any person to blame any one factor. It's all reopening. It's all protests. That's simply not true. But a combination of these different factors, to be sure, is the explanation for why we're seeing these increases, particularly amongst younger populations. Now, fortunately, those younger populations, that is not yet translated to mortality. Now, mortality is a lagging indicator. We'll have to see. But we're hopeful that we're seeing at least this case growth is happening amongst younger people who seem at least to be able to better tolerate things thus far.
All right, Lanhee Chen and Dr. Zeke Emanuel, thank you both for joining us. Appreciate